This is Talking Ears. I'm Juan Vasquez.
I'm Frank Ordinger, and this is one of the last installments of the National Hearing Conservation Association's Updates in Music Audiology Workshop Recap. Wow, what a mouthful. And what do we have in stall for us today, Juan?
Today, we are actually doing the panel discussion on teleaudiology, and this was something that has been a format on the show before, but here we actually get a little bit more perspective from the speakers.
Since we presented this panel live in the room, sort of like we would arrange a podcast, I'm actually going to let past us take it away and explain what we're going to be talking about. We're going to be talking from the perspective of experience over the last couple of years with one specific program. If you know of another program that does teleaudiology on this level, please let us know. Please let me know. I'm very curious. The specific program that we're talking about is Tuned, which you've heard mention of. Tuned is an online platform that does teleaudiology. It's, as far as I know, the only one that does it, so I'm not trying to be commercial about this. It's literally the only one I know. Heather was the spearhead for that from the audiology perspective, but it is a tech company, essentially, that's running this program. They paired up with Music Cares, a group that many of us have been seeing musicians through for years and years and years before this even happened. If you've never heard of Music Cares, you have heard of their parent organization, the Grammy Association or the Recording Academy. They have a charitable wing that provides health services, financial assistance. During COVID, for obvious reasons, a lot of musicians needed Music Cares for financial assistance. The biggest thing they do is addiction recovery and dental care and medical screenings. Oh yeah, look at the very bottom. What does that say? Hearing wellness. They became kind of known as the people who do earplugs a lot at venues and festivals. But during the pandemic, we couldn't do that as much. So they thought, how could we do this? And through the wonderful leadership of Heather Maliak, she designed this wonderful protocol. So this is what we're going to talk about just in a second over here with the panel. But the appointments, just to give you an overview, and then we'll ask specific questions about it, involve a thorough questionnaire that's done ahead of time. It is, 2,000 questions? How many questions? It's a lot of questions. It's very thorough. There's a hearing screening that we actually developed. I'll let Laura talk about that in a second. We then meet with them for an hour of an online meeting, one-on-one with a music audiologist to meet with these musicians, interpret their results, go over their questionnaire, and then deal with whatever kind of referral outwards that they need to do in-person care. But most of the time, in my experience, and I think everybody else's, it's just education. It's just counseling, and it's like the part of the appointments that we love. So without further ado, I would love it if my panelists could come on over to my weird little round table over here, and we'll get started.
I wanted to say something before the panel starts, because Frank likes to say, oh, Heather this, Heather that. Everything that I designed for this program, I learned from Mike Santucci. And I just wanted to say that because I think it's important to say.
That goes without saying, but thank you for saying it anyway. Thank you, Mike. The first question that I have is just a quick reflection for anybody. I find the most interesting thing about the appointments is that we can really focus on the education and the prevention talk. Does anybody have any reflections on how that's different or similar to in-person meetings?
I think it's really hard in private practice when someone comes in and you know they are paying for it and you want to try to keep an hour, the appointment to an hour and you have a lot to do. Sometimes the education suffers. I find that with the Music Cares program, because it's through a grant and they can sit down with you for an hour and you don't have to do diagnostic testing. You don't have to get through that. You don't have to get through ear impressions. You can really dive into their needs and cater your education exactly to what they need. And they don't have to spend an hour and a half or 2 hours with you in the clinic, and you don't feel like you're not making your overhead. And I hate to say it that way, but that's part of it when you're a practice owner.
Something similar, I noticed that over the years doing this, I barely talk about even the results of their hearing screener. And I used to be so obsessed with the audiogram because I'm a nerdy, mathy type of person and I love graphs, but I love that not even having an audiogram, it just forces you to put the focus on the individual.
Yeah, it's amazing to be able to just focus on the education component. And even though we don't have to use the full hour, if if you cover all their concerns within 30 minutes, and you don't have to fill time like I am right now with this answer. I'm sorry. You wanted short answers. I have to think, oh, this is easy. They have normal hearing. They just want to learn a little bit more about how they hear. This will be half an hour. I use the full hour every time because as they learn more, they are so interested and asking really incredible questions. And so, like Laura, I often find myself realizing I have 3 minutes left in the session. I go, oh, let's review your test results very quickly. So it's amazing to be able to just focus on education, which is, as you said, empowerment for them.
And I think that's my favorite part, really spending the time with the person, talking to them about their music and how they use their ears. You're teaching them something, but what's even better is when they understand.
I've also found that we have a different amount of attention when somebody is on a teleaudiology or telehealth visit than sometimes when we're in person. I have a lot of times where people are distracted because they had to get there and park, or we're in a strange space. Very often we're doing mobile visits. I mean, there's lots of distractions. If we're in a venue, they're being called away every 12 seconds to go deal with some fire that they have to put out. But in a televisit, it's pretty easy for somebody to put aside an hour to book a Zoom call and really focus. I found that really helpful. I'm going to jump around a little bit. You mentioned how we can take our view away from the audiogram, which is very often not what we do in clinic. We focus so much on those test results. But because we don't often have a diagnostic audiogram in front of us, we have to discuss other stuff. I've enjoyed that change of focus. But I'm curious, Laura, if you would like to talk about the development of the new screener and kind of what went into that, why you wanted to make it not resemble a audiogram in the normal sense.
So for a while, we were using I'll call it a hearing test, developed not by us, and we were displaying the results as an audiogram. We knew that we couldn't call it an audiogram. We knew that we were not diagnosing hearing loss from it. We even had written over it in gray letters, screener, not diagnostic. But I think a lot of us, even myself, found ourselves still like, ooh, you've got a little hearing loss at this frequency and a lot of maybe this and that other area. So it came to a point where the company decided we wanted to try to develop our own hearing screener. So we were calling this a screener, even though if you look at the definition of a healthcare screener, it was not a screener, and we were not interpreting it like a screener. It was clear to me that we needed to actually pull back and simplify it, and mostly to prevent giving the wrong information. The other elephant in the room that was clear to the audiologists were calibration issues, right? To try to attempt to do a threshold-based acoustic tone test online when you don't know the transducers people are using, you don't know the sound card specs. So, and really, Heather and I had talked like we just shouldn't even have a tone-based threshold screener, but we weren't in charge. What I think was really great is there were lots of meetings and lots of us attempting to explain all these things. And in the end, they really did let us design what we thought was best. And it was a compromise. Does anyone know Barbara Weinstein in here? Okay, so she developed the HHIA, and she is an expert in hearing screening. So I consulted with her a lot. So with all this research and asking the real experts, I thought, okay, this really should be as close to a screener as possible. A screener is a pass or a refer. But we did take some liberties. We did divide it up into a few different frequencies and a few different levels. And then I thought, this is like too much for me. I need to bring in another nerd. So I asked Frank, please help me. So Frank and he was amazing. We got to the point where we needed to calibrate the system for our validation study. So Frank basically did the calibration. We decided on transducers that already had RET spells, even though it was like discussed, we should try to calibrate it to the AirPods Pro. But then when you start looking into that, there are no RET spells, and people can change 100 things on the AirPods Pro. So once somebody changes one parameter, there's just your calibration goes out the window. So we did a calibration, we did a validation test, and the results were great, but we understand that, this is still imperfect. It's done with a very specific pair of transducers with an iPad. But that was a development, and so we have that screener now. it is one small part. And even though I still sometimes lay awake at night thinking we just need to get rid of it, it is helpful. It gives us a little bit of an idea combined with the other digits and noise screener that we have on there, which should give you an idea of the 4-frequency pure tone average. So that's when you put your audiology thinking cap on, and it still does provide information when there are strange results or results you don't expect based on their case history. They tell you the transducers that they use. They tell you what their environment was, what the sound card, so was it a MacBook or a Windows computer? So if you're familiar at all with looking at those parts of the audio chain, you can usually figure out, can you redo this with a different pair of headphones, etc. So I do love the screener. We made it really kind of simple and fast. So it's a good patient experience. It looks good. Yeah, so it was quite a ride. And in the end, we got something simpler, but I think it is more accurate and better for the patient.
I like that in the order of your answer, you went from loving it to hating it to loving it to hating it several times. That was a roller coaster. You mentioned the DIN test, digits and noise test. For anybody not familiar, it's very similar to any speech and noise test, except it's very quick. It's very simple. I was wondering if one of you guys could talk about how the DIN test helps with your management, your discussion, your counseling.
And just to preface it by saying, I think that often in clinic, don't come at me, the audiogram holds us back. And I feel like the audiogram is quite antiquated. Not that I don't love it. I'm an audiologist. But I think that just looking at someone's pure tones is, oh my gosh, what are we doing? Sometimes I sit there and think, what are we doing? We don't even need this to talk to a music industry patient. The digits and noise, I often find in an appointment, someone says, I really enjoyed that test that had some background noise because that felt like I was in the real world and like you're really listening to my complaints, because so many complain about that. And like Laura said, we're really looking at a 4-frequency PTA. So it is nice from that clinical perspective. But that's what I find is that people say, oh, finally, like a real hearing test. The reason why the development of this was a pure tone screener, digits and noise, and a ton of questionnaires was because we were trying to recreate something like an in-person appointment where you give a pure tone test, an SRT, word rec score, something that you could compare and then use your clinical brain. So we find that a lot of things online where they just have an online hearing test, it's some beeps, right? And maybe 2 questions. And from a clinical perspective, I didn't think that that was enough to go off of. And so that's where the DIN came into play. And it fits beautifully into the appointment in terms of discussing something like hidden hearing loss or other issues they might be having. One thing Laura mentioned is that we can see what transducers they're using and maybe their sound card. The idea behind asking about that, and the reason I want you to know this, is if you're using an online screener because you're working with someone across the country, say, have them note what they're using so that if they do it again in a year, have them use the same setup. That's the idea behind that, so that you can hopefully have something similar year after year.
One thing that's come up with the digits and noise test for me is that sometimes, at least with the old screener, it would disagree with the audiogram in front of me. Because the digits and noise, for anybody who hasn't done it, it tells you what their signal to noise ratio is at the end of it after they try to listen to words being numbers, spoken numbers, in the presence of increasing levels of background noise. And if that digits to noise test says that they have a -19 signal to noise ratio, they have pretty good hearing. You can't really have a lot of hearing loss and do that poor or that well on the test. But then if their audiogram is showing a 50, 70 decibel hearing loss, we know that there's a technical issue. So that's really saved me in a couple of visits. Have you guys had a similar experience or anything else to add about it?
It's a really good counseling tool because so many patients have their audiogram done and they're told, you have normal hearing. Why am I struggling to hear so much then? And then we get their digits and noise test results and they have a mild to moderate impairment in noise. And so it's a way to validate their experience and then come up with a plan to help them function better in those sessions too. So if we didn't have that as a tool, we couldn't be as precise in that regard.
I would like to add to that because in poring over the development of the digits and noise and those articles, if you really look at the validation study papers, there's a lot of variability in the results. So if anybody in this room has ideas about more accurate online hearing assessment. Let's talk.
I have an idea. I think that one thing we're all disappointed with is that we don't have a better way to reach people who aren't physically with us in terms of assessment. And since there are researchers in here, and since I don't want to be one, I'm going to tell you, everybody who comes into my clinic in person has extended high frequencies tested, in addition to an basic audiometry and words and noise. And I have a lot of data, and I think that we could come up with an online words and noise to figure out extended high frequency hearing. And I'll give you the numbers, and you do the study, and let's create it.
I've never seen you get so excited about something. Words and noise. That's amazing. I wanted to move on to a big thing that I see as a benefit for teleaudiology, and this is a leading question, but accessibility is what I find to be the thing that wows me. Really, I thought it would just be doing clinical appointments, but on a webcam, so I could wear sweatpants at the same time. And it is. But also, I find people joining visits in their own comfort way because their schedule does not allow a regular clinical visit. I've seen people who are on tour out of the country, halfway across the world, in a tour bus or in a corner of a very noisy venue, doing their 1-hour appointment with us, even though they didn't know they were going to be gone when they made this appointment, right? One that sticks out to me was a dude who signed in, and he was sitting on a beach. He was sitting on some driftwood, and that was really pretty in the background. And he seemed really chill. He was a California guy, and just laid back, long hair, seemed totally chill. And he explained, I would not come into an audiologist's office. I never have. I've made appointments. I never got there. I've canceled every time because it stresses me out, the idea of going into a place and being told I'm doing it wrong, I'm hurting my ears, I know this is the case, this is my job. He's an audio engineer. But here I feel relaxed and I can have this conversation. This is the one space where I felt like my anxiety would allow me to come to this visit.
I think the accessibility part is, again, another one of my favorites about this. I am able to see a musician from New York, but they were in Chile, or a musician who was on tour and they caught the appointment when they were in between flights. Meeting them where they're at, again, it's the education, because some may not ever come into an office. They may not know what an audiologist is. I've seen patients who had no idea what to expect with this. And, that feeling of them just leaving with all that insight and just going, wow, this was fantastic.
Someone that I recently saw on Tuned within the last 2 months, I think, when they logged on, they were sitting on the steps of it. It looked like a government building or a courthouse or something. And they were like, sorry, I'm running a little late. I meant to do this in my car, but I had a hearing to just make sure I have housing next month. And it ran long. And I think my jaw actually dropped open that this is their priority. They secured their housing and they logged on for their hearing health appointment. It was just a profound pairing. And then I've also just been amazed at I've seen a good number, and I'm sure everyone has, of well-established people in the industry who have been in the industry for 40 or 50 years. I won't name drop the musician, but I had someone on the crew for Ringo Starr on Tuned who has been with him for 35 years, and it was his first time talking to an audiologist ever. And so I think something we've all been happy to see is that there's a lot of young people logging on to seek preventative hearing health care, but we're also seeing a lot of seasoned professionals finally getting the access that they need to these really important services.
I think a lot of folks think of the music industry and they think of people who have money, and that's not the case. And I think Chappell Roan's acceptance speech at the Grammys recently was really interesting to hear. In terms of the access, I wanted to say about Music Cares, what's so great about this is we don't realize that in our country, audiology is a luxury service. Those of us who work in it are often seeing people who are more privileged, or people who have saved up for a long time to come in and get their custom earplugs and have their status symbol and finally be able to start protecting their hearing. One of the nice things is we're reaching people who've been in the industry for decades, but we're also reaching really young people in the industry who don't have those funds yet. And Music Cares is allowing them to come see one of us experts and get educated. And what we hope is down the road, when they are ready for something custom, We all talk about this with them. Who should they go see? What should they get? How can they prevent further injury when they get to that point? And I expect we will see a big shift in the hearing health of the population because of this. The second thing I wanted to say is I know we're talking a lot about tuned, but for those of you getting into work with music industry professionals, you mentioned the comfort of where they're located. The diplacusis patients that I see are mostly telehealth, not overtuned. And I recently had someone who honestly lives one city away from me, but we did telehealth care because that's where he is comfortable. He was home with his instruments. I'm not going to go over to this guy's house, right? But like I can sit on my laptop and see him in his home. And the care is so much better that way than him coming into my office and us trying to figure out what to do with his instrument. Just my point is sometimes it's better when they're in a comfortable situation for certain kinds of care.
That's such a good point. When you do mobile visits, very often you end up in somebody's studio or rehearsal space and you can be with their instruments. I had the same exact situation. It was a mastering engineer. He was having a specific issue with his setup. And he comes into the clinic and he's describing it to me. He's like, I just wish I could show you. And I'm like, great, let's meet next week on telehealth. And then he could show me what's going on. This is when I'm hearing that distortion. Okay, let's talk through that. We have a little bit more. I have two more big things that I want to get to, and you kind of started to hit on it, so let's jump to that one, which is at the end of a lot of these visits, we spend a lot of time doing case management is kind of the best way of thinking about it. We see people from all over the country, and a conversation that's always happening is, okay, now who can I see in Nashville? Who can I see in wherever I happen to be? If it's Nashville, great, I got some call outs. If it's Northern Montana, let's try to figure this out. And that gets a little complicated. And what we end up saying is something along the lines of, you can see any audiologist, but these are what you should ask for. And so we're trying to arm the musician so that when they come in, they can speak our language. And what we're trying to do with these workshops is to arm us so that we can speak the musician's language. And somewhere in the middle, I'm worried we might hit, and that would be good. So anyway, I was curious if you guys had any thoughts about the referral to local providers, but also, if you want to go there, referral to specialists on the platform.
So on the platform, they can be referred to a tinnitus specialist, a vestibular specialist, and up and coming is auditory processing specialist. We're not quite there, but we're getting there. The other thing he mentioned is referring to audiologists. We often use, if you've taken the Gold Circle course, you're likely listed on the Sensophonics website, and that's a link. I do chart reviews every week of all the providers on Tuned. I see that link all the time in notes. Go here, find a provider. If they're not on there, we cross our fingers and whatever. So the other thing is, in order to be a provider on Tuned, I make you take the Gold Circle course and then pass a really difficult essay test that I wrote. So if you want to do this, you talk to him and you talk to me.
I was going to also plug the Find an Audiologist tab on the Sensophonics website. We just added one to Vermont, my home state. So we're not in all 50 states yet, but perhaps by the end of this year, we'll just keep chipping away at it. So if you know an audiologist in North Dakota, we'd like to get one there and beyond. Oh, and I'll also just, what's also been funny is I've now had 2 patients in the Sensophonics clinic who I say, what's bringing you in to see me? And they say, oh, I had this great appointment that was covered online with MusiCares. And they mentioned that Sensophonics is in Chicago. And I was like, so there are even ears in Chicago that don't know about Sensophonics. And so it's helpful to have all these interconnections. And if you haven't realized it by now, music audiologists are a really tight-knit cohort, and there's a collaborative spirit to everything that we do, and we're constantly referring each other patients and just trying to have the best outcome for musicians as possible. So it's just a great team to be a part of.
When somebody says they're in Chicago and they clearly need custom earplugs, I get so excited. I'm like, I know exactly where you need to go. You have to go. But I just wanted to plug Elliot Cash, who's in the room, and he runs a custom earplug company out of Brooklyn. He operates out of a studio in Brooklyn. It's so cool. I used to want to do that, and maybe someday I will. But sometimes when you explain to the telehealth musician, well, you need to go to an audiologist, get your ear impressions, and that's probably going to cost this, and then the earplugs are that. I have recently had a lot of people in Brooklyn like, oh, go get on his newsletter, and he does pop-ups. He comes to you. And so yeah, just this idea, like, I always go to the Gold Circle audiologist website, but yeah, there are sometimes people in that city, and it's great to expand the network to know who we can refer people to.
I realized in the intro I should have mentioned one thing. A lot of musicians don't have regular health insurance. They might have health insurance when they're on a tour, for instance, or working for a specific gig. But between then, most performers and audio engineers are freelancers who are on their own. So they're kind of just rolling the dice. That's where MusiCares is actually really big in stepping in and funding these additional services. And one thing I want to mention with that is that there are additional hearing health services that MusiCares is then funding, not just this initial visit, but also if they need hearing aids, they get a pretty sizable benefit for that. If they need special in-ear monitors, to 3DME, for instance, is covered, the thing that we've been talking a lot about. So part of the benefit there is really that they actually get the coverage that they would be getting if they had some kind of insurance or something. One other caveat that I should have said up front, it's such a tight-knit community that we end up talking a lot about Sensophonics and Michael's company and the products because there's just not other things that are serving this community. And that's almost like a call to arms that we need more attention in this community because it's such a small group of companies that are actually creating amazing stuff to help everybody. We have a lot of companies making stuff that hurts people's ears, not a lot of companies doing stuff that actually helps. So if it sounds a little bit like we have a bias, it's because, well, we may, but also show me an alternative, please. We have a couple minutes left. Is there any questions from the audience? Yes, please.
So we know that musicians talk to one another, and they always do. Have you found that any of your patients in Tuned have been referred by other musicians already to come in?
All the time.
Have you been seeing more of a penetration into musicians since Tuned has been starting up?
Let me repeat the question. So he said that musicians discuss with each other. So have we been seeing internal referrals from musicians to tell other ones to sign up and take a visit?
I don't think Tuned has changed that. I think that people always talk. They always say what they're doing. My term for it, you play a gig and you go out back and you do SIGA networking, right? And you bum something and, whatever. And you say, well, this is where I got my earplugs. I think that the only thing that Tuned has changed is just allowing a path for MusiCares to get to providers. And I think there are a lot of people coming through Tuned to see us because they don't have to pay for it. But I don't think it's made more people aware necessarily. It's just given the access to them.
There are times I'll see somebody on Tune, and the next week, oh, my band member told me about it. And then the next week, oh, my band member, it's the same band. And then over a month, you see the whole band. Yeah. So that
I was going to say the same thing. I've had, I think, 2 full bands come through me because the singers come on. Like usual, the singer's just getting killed by the drummer, and they're like, I need something, I need help. And after you help them, they're like, this is great. And over the course of the next 6 weeks, the entire band rolls through on Tuned.
So I'm an Appalachian fiddle player. You don't get very far with touring when you play in that genre. But the people we reach with Tuned are some people who I used to know when I was touring. And it's always fun when you get on a call and they're like, Heather, you're an audiologist now? And so we get to see people like that too, which is really fun.
We have to stop for time, but I just want to say one more thing about this program. If you see a professional musician in a clinic, if you're a clinician, and you see a professional musician, they mention anything about, I've been playing for years, I have records, I work in a venue, I'm a bouncer at the local venue, please just mention MusiCares to them. A lot of musicians still don't know about it, and I don't understand why. I will talk with veteran musicians, who say, what? There's a thing called music? Like, yes, and you're probably eligible right now. So please sign up. Please just mention that to them, whether it's coming for hearing health or any of the other 1,000 things in their life that they need help for. It's a wonderful program.
I was just going to add one more thing. And
No.
Sorry.
No, go for it.
You just reminded me that, for a lot of people that I see, Tuned is all that they need. An annual appointment on Tuned is exactly what serves them. But for many people, it's also a starting point. They need information about where to go, what to do. And that's when we start connecting them with IRL audiologists too.
In real life, I'm assuming.
You got
Okay,
it.
Thank you. I don't speak meme. So thank you guys for participating, and thanks for the wonderful panelists.
Talking Ears is a production of Earmark Hearing Conservation. The theme music is by Scott Hallam. You can find more of his music at audiodowsing.com. The show is produced and edited by Juan Vasquez, Scott Hallam, Mary Kim, and myself. Thanks for listening.